Lower respiratory tract infections lead to substantial mortality and morbidity worldwide. Of these, influenza and respiratory syncytial virus, or RSV, are the most common lower respiratory tract infections outside of the COVID-19 pandemic, affecting a considerably large population globally and specifically in the United States. In addition, the medical resource utilization underlying these infections is quite high, owing to innumerable hospital days, outpatient visits, and social and economic burden. At present, there are limited assessments on the characteristics of patients hospitalized with influenza or RSV and their medical resource utilization during and post-hospitalization. Understanding this information is essential to better characterizing populations at risk for developing influenza or RSV infections and improving prevention, diagnosis, and treatment. To this end, an international team of researchers conducted a prospective cohort global study between 2017 and 2019 in adults with acute respiratory tract infections called the Hospitalized Acute Respiratory Tract Infections, or HARTI study. The core risk factors for both severe disease and medical resource utilization in adult patients hospitalized with influenza and RSV were identified, and hospitalized patients were monitored for 3 months post-discharge. This global data has been presented in aggregate previously. For this analysis, the team examined data only from the U.S. cohort of the HARTI study. They found that hospitalized patients with RSV had a higher proportion of core risk factors, such as aged greater than or equal to 65 years, or had chronic heart disease, chronic renal disease, chronic obstructive pulmonary disease, or asthma, and were older than patients with influenza. Among all patients with core risk factors, those with RSV were hospitalized for longer durations and required more frequent oxygen supplementation. At 3 months post-discharge, a larger number of RSV patients with core risk factors required continued medications compared to patients with influenza and core risk factors. Regardless of the pathogen, patients with core risk factors reported substantial hospital readmission rates compared to patients without core risk factors. The findings highlight that in the U.S., the disease burden and medical resource utilization underlying RSV infection were comparable to or greater than that of influenza and are far underappreciated in general. This calls for a renewed focus on the surveillance of RSV infections in the U.S. and education about adult populations at risk of developing severe disease.